If I was your nursing school tutor and you asked me to explain beta blockers, here's what I'll tell you. Most beta blockers end in OL, so we're talking metoprolol, atenolol, labetalol. We have beta 1 and beta 2 receptors. So beta 1 receptors are commonly found in the cardiac muscle and the renal. Beta 2 receptors are primarily found in the lungs and other parts of the bodies like the GI tract and the liver. If you're having a hard time remembering that, just remember we have one heart, beta 1, and two lungs, beta 2. So when you give a beta blocker, it's going to stop those beta receptors in the heart or in the lungs from being stimulated. So when we block those beta receptors, you're going to see decreased cardiac excitability. The heart is not as excited. This is also going to cause decreased cardiac output, and in turn, it's going to lead to decreased myocardial oxygen demand. So the heart muscle does not need as much oxygen anymore. Beta blockers can also lower blood pressure by decreasing the release of renin in the kidneys. Beta blockers can either be cardioselective or non-cardioselective. Cardioselective beta blockers only work on beta 1 receptors, so the heart. Examples are metoprolol. Non-cardioselective beta blockers can work in the heart, in the lungs, and other parts of the body. Examples are propranolol. Now let's run through some of the side effects you need to know for NCLEX. Bradycardia, right? The slowed heart rate. So you need to watch your patients for bradycardia, which can also cause dizziness, fatigue, lightheadedness. That bradycardia can also lead to irregular heart rhythms. Also, because non-selective beta blockers can work in both the heart and the lungs, in other words, they can block receptors in both the heart and the lungs, we want to avoid them in patients who already have an irregular heart rhythm, like an AV block. Avoid them in patients who have issues with breathing already, like asthma, bronchospasm, or even heart failure. So here are a few things you also need to remember as the nurse taking care of a patient taking this medication. Hold this medication and talk to the doctor if the patient's systolic blood pressure is less than 100 or their pulse is less than 60. Propranolol can also mask the signs and symptoms of hypoglycemia in diabetic patients. So when in doubt and you can't remember, just remember beta 1, one heart, beta 2, two lungs. Cardioselective only works on beta 1. Non-cardioselective works on both beta 1 and beta 2, meaning that it works on both the heart and lungs. I hope that this helps you understand. These are really broken down just to highlight the most important things you need to know for nursing school and for NCLEX. If you found this helpful, let me know in the comments and share this with somebody else who might need it. But until the next time, bye-bye.